Welcome back to the Burnout Recovery Podcast. Today, I'm delighted to invite Dr. Amandeep Hansra as my guest on the podcast today. Amandeep is a GP and works in health innovation and the startup space. I've had the pleasure of meeting Amandeep at the Clinical Entrepreneur Program, the Australian version, which started in October last year. Amandeep, welcome to the podcast today.
Thanks so much for having me, Joe. Very excited to be here.
Yeah, so I'd love you to share a bit with my audience as to the wonderful portfolio career that you have created for yourself and what it is that you do sort of most weeks, most days, please.
Great question, Joe. I feel like every day is very different and unique for me. I still obviously practice as a GP, very part-time now, and a lot of my time is spent in the sort of digital health startup and investment space. So a lot of my focus these days is on finding great investments. So that's really helping investors work out where should money capital be allocated in the health innovation space. So what new digital health technologies might we fund? What biotech might we be looking at? Anything that's going to change the way we deliver healthcare. And so my goal is really to find great innovation, help nurture entrepreneurs, and this is part of why I'm part of the Australian Clinical Entrepreneurship program. So I really love seeing clinicians step out of their everyday to day and focus on developing new programs, services, technologies, companies that are going to change the future of healthcare. And so I kind of mix my time around working with founders, with investors, working with government, and also seeing on the ground what are the problems that are still facing us as healthcare professionals. So it's a nice mix, Joe. Every day is different. Every week is different. And sometimes I have no idea how the week's going to end, but it's always a great ride.
Yeah. Wow, so varied, so fun. So I think you were one of the pioneers in the telehealth space, and you were involved in that even before we had the pandemic and all became so used to telehealth. Do you want to share a bit about how that came about and that sort of pioneering side of health there?
Yeah, great. Great question. So the whole telehealth journey was way before anybody really talked or knew what telehealth was. I mean, obviously in Australia we've been doing telehealth forever, although we've never really labelled it as telehealth. If you think back to RFDS days of using two-way radios to provide care into rural communities, and that was telehealth. But we didn't really have a definition for it. We just used whatever was available to communicate and provide healthcare. And so when I got involved over a decade ago, it really was seen as a new thing. And all we were really doing was using existing technology, which was the telephone, to talk to patients. And it doesn't sound that exciting or new or revolutionary, but at the time it was quite, a new way of doing care because we weren't used to managing people over the phone. And so when I got involved in that program, I was really excited because I thought, well, there are ways that we could even improve this by using, say, video conferencing or being able to do things like prescribing over the phone, which was a complete no-no back then. And then it just, all changed during COVID, and suddenly the phone was hot. Everyone was ringing me, asking my advice on how do you do consultations over the phone or over video? What do we need to be worried about? What technology do we need to use? And it was a really exciting time for me personally from a career perspective, not that I was happy about the COVID pandemic, but what it did do is it brought a lot of my peers on this journey around the use of technology to improve access to care. So something I'd been harping on about for a long time, could not get funding for it through Medicare, could not get general kind of health professional support for it. Yet I could already see the benefits, way before the pandemic. And now, telehealth is just such a, normal part of delivering care these days. And we've seen a lot of practitioners switch completely to telehealth, some who've managed to find a happy medium between face-to-face care and telehealth. But it was a very lonely journey at the beginning. And, I was there before it, became fashionable. And now I'm grateful to see it, in my lifetime become part of the norm. I mean, still we've got a long way to go, but it's certainly moved much faster than I could have ever imagined, had we not had COVID.
Sure. Yeah. It's that sort of beast of a machine in medicine that can sometimes be slow to move and to change and so forth. And I think you're exactly right. What has happened in what sounds like the 10 years that you've been involved in it has really accelerated due to the totally unexpected last few years that we've had, and the need to be providing medical care when people were barely moving around the streets.
Yeah, absolutely.
Yeah. So that's like a great healthcare innovation that has really come through quite fast. Let's I talk about burnout on this podcast. So I would love to ask you if you've ever been close to burnout at any point in your career, and how might that have looked for you, or maybe not if the case was not.
I think that there will probably be very few healthcare professionals who have not experienced burnout or been close to it. I think you would be a pretty unique person to have managed to navigate a whole career in healthcare and have not felt those pressures. I certainly have had my moments. And I think I found my way through it by creating this sort of portfolio career that I do have. I think particularly when you're in those younger years and a lot of important things in your life all coincide at the same time. So you're trying to build your career, you're trying to do training, you're also working, you also potentially have young kids or a relationship that you're trying to focus on, buying your first home. There's a whole bunch of things that all coincide in terms of timing. And it's a shame because if each of those things, were spread out, you probably manage fine. But I think they all come together, and around that time, it's high pressure, high intensity, and we're in a job and a profession that requires a lot of us emotionally, physically, academically. We're expected to do a lot, give a lot, and then when you add life stresses on top of that, it doesn't take much for everything to kind of topple over.
Yeah.
And I've certainly had moments. I think I've had multiple moments that I've been burnt out, and I've become much better at recognizing them and also understanding what I need in those moments before I get to the point where I'm not of value anymore to anybody. Because, you can end up in a situation where you're like, if I just, grit my teeth and bear with it and I'll get through it to the other end. But it doesn't work that way. You actually need to change something. Otherwise,
Yeah.
it does end badly. So, yeah, I've definitely had those moments. I think particularly when my kids were younger, and really struggling with the whole balance of everything and parenting as well. But I've had moments even, more recently where I felt like, especially during the pandemic, where for many people it was like, okay, we had to sit at home and watch Netflix. That was not my version of the pandemic, and I'm sure for most healthcare providers that was not either. But I remember just being totally and utterly exhausted and feeling spent, at the end of the pandemic, and thinking I have nothing, left, and I need to fill my cup up again. But I have managed to navigate myself out of all of those situations by finding that healthy balance of the things that I love doing, that fill my cup, that give me energy and allow me to continuously, give back to this community, this sector that I'm very passionate about.
Yeah. Yeah, and I would say you're such an amazing community builder from the OSCEP community, the Clinical Entrepreneur Program, which has got a huge community of mentors, as well as the group in New South Wales, Victoria, and WA, Western Australia. You've also built the creative careers in medicine community as well, which is quite sizable now. Is it 16,000?
I think we're about 18,500
Yeah,
members
right.
now,
Yeah.
which is very exciting. Yes.
Yeah, fantastic. So what were some of your thoughts behind why you set up CCIM, please, Amandeep?
Oh, you know what? It was a bit of a selfish reason. I mean, I was looking for a community for myself and, didn't feel like I belonged anywhere. I was doing some very unique things in healthcare where there weren't a lot of other healthcare professionals next to me doing the same thing. And, usually you can, if you're a GP, you can find other GPs. If you're a specialist, you can find other specialist peers that you can share your experiences with, and you can, vent to, you can go through, things together. And I felt like I had the GP community, but for the other roles that I had in sort of, more of the corporate sector and things I'd done in technology, there wasn't really a community that existed. There wasn't a college or a peak body I could go to. So really, initially, it was find my friends kind of approach. Is like, who do I want in this group that I would love to hang out and share kind of our experiences together. And I'd managed to start to network. Finding these clinicians who had done different things, who'd ended up, running companies or working in technology, or, had taken on leadership roles, who maybe weren't seeing patients every day. And they had different kinds of challenges and different difficulties to navigate, and they still needed peer support, and they still needed a community. And initially it was just really bring this group of people together. But what you find is, if you go looking, you find even more. And I went looking, and it wasn't just, 4 people or 40 people. I think the first event we had over 400 people that turned up. And I realized that this community was actually much larger than I could have anticipated. And then we went online and we just grew and grew, and people started joining. And people who had very mainstream careers but were coming in to look at the other side and say, what if, I want to know there's something else out there if this doesn't pan out, or how do I mix, how do I do partly this and partly that? And we started to attract a lot of medical students who already knew when they were studying undergrad that, a full-time clinical career seeing patients was not their whole future. And so, so as we grew, the community continued to grow, and we continued to offer lots of, services that we could, whether it was events or training or access to courses, giving people an opportunity to meet each other, look at new jobs. And that's really how we've sort of grown and how we continue to grow.
Yeah, it's a great space. There's often a lot of discussion about careers I'd never even thought of or been aware of that we might end up doing, even with a medical school training in the background there. And I guess with medicine, it can be a very sort of blinkered, this is the pathway you jump on, this is the pathway you continue going on. What would you like to share with the potential medical trainee at whatever stage they might be of their career about jumping off the tracks to try something different, sort of the benefits of having a portfolio career, how you might get started with trying something different, and venturing into that idea of a portfolio career. Maybe you can share, I don't know where your first trajectory was that happened for you, unless you were already doing things in parallel when you were a medical trainee.
Yeah, look, I wasn't. And it happened very organically for me. I didn't set out to create a portfolio career. But inadvertently I've ended up in one. And I think, I've had some interesting insights from doing it, because I found that as soon as I was doing other things on other days, the days that I went back into general practice and saw patients, I felt much more excited about it, and I felt like I had more to give.
Right.
Noticed that my empathy and my kindness, capabilities were much higher.
Yeah.
And and I just felt like I had the emotional capacity to really empathize with patients, what they were going through, and I felt motivated and excited about helping them. I think the times where I have done general practice 6 days a week, which I've done, previously in my history, I do get to that point where you start to feel a little bit desensitized to things, and you think, when you're just hearing a lot of this, distress every day of your patients, whether they're in pain or they've got, other symptoms, difficult things going on, there is part of you that builds that kind of wall of, well, I won't let it affect me. And I'm not saying it's good to let it all affect you, but I think you want to be able to feel a bit of it, to be a good empathetic doctor. And I found that, a lot of other doctors that have come to me during the years that I've built CCIM have tried this stepping off that, sort of conveyor belt and saying, well, what if I did do a day a week doing something else, whether it's something non-clinical or working on a business idea I've got, or an innovation, or doing some research, or teaching a day or two a week. And I found that it really provides that balance so that they don't feel burnt out just seeing patients all the time. And the more and more I have interacted with people with portfolio careers, I really have started to think it is possibly one of our solutions for sustainability in a medical career. I think gone are the days where we will require people to work full time, patient facing, for decades on end, and expect, that they will be happy doing that, they'll be fulfilled doing that, and that they will, reach their maximum potential. I think as human beings, we have to recognize that we need that diversity. We need that time to step away, let ourselves recharge, and come back. And sometimes, they say a change is as good as a holiday. And I think having a change on a different day and say, well, today you're going to work on an innovation idea. And this is how the clinical entrepreneurship program started in the UK. It was really designed as a program to stop attrition of medical staff from the NHS. So they thought if we offered them a day or so a week to work on an innovation idea, they're less likely to get burnt out and leave. And it's been a very successful program. If you look at how many companies have been built, how many jobs have been created, how much capital has been attracted to all the companies that have come out of the clinical entrepreneur program, it's been a very successful program. But I think it has taught us that clinicians are very smart, very motivated, very driven. Many of them have got creative ideas and can come up with solutions. And we should really allow them time and space to work on those, alongside also being a really great, patient-facing clinician. And I think the future, we're going to see a lot more of that mixing and a lot more of those portfolio careers, and allowing people to have more than one stream to their career, because I think that's really important.
Yeah, definitely. And not trying to squish it into an evening on
No,
top
God.
of 6
Yes.
days a week of medicine, or like
Yes.
however many on-call weeks and on-call shifts you have to do in that, but just allowing like the daytime brain to be applied to the project that you're
Absolutely.
doing when you're fresher. And it's just that change up. I certainly love still maintaining my clinical career in traumatic brain injury rehab medicine, as well as coaching as really sort of the mainstay of my career now. And it's such a change compared to how it was before.
Yeah, what a lovely mix, to go from one end to the other, and just I think it just helps you see it gives you a whole different perspective as well. And I think you may think that your two interests or three interests are not related, but I can guarantee you'll always find things that you can bring from one role into the other, and there's always value that you can bring from doing other things, no matter how disconnected they seem.
Yeah. I reckon my relationship with my team, so I work with an allied health team there, and I honestly just think I'm more connected to them as other humans when I have more of this balance of how work is. So it's not so much clinical work, but that non-clinical work in there as well.
Yeah, it gives you a chance to miss things. I like that I get a chance to miss the four walls of the practice, or I get to miss sitting in front of a patient. And it's terrible when you don't miss it because you're just doing so much of it. I think that's a sign. It's like have a step back, and and sometimes seeing the big picture and realizing what you are doing and the impact that you're having is really important as well.
Yeah, absolutely. Yeah, sure. Great. So I guess for those people that are maybe doing 100% medicine at the moment, a place for them to start, or a contact or connections for them to make to sort of talk about where they could go or what they could do in addition, I guess could be through your forum on CCIM, if it's good to share that. So that's
absolutely. So look, CCIM is a great forum where it's not just me talking, but there's a lot of other people contributing great, advice, wisdom, knowledge. I think the most important role that it plays is also giving you a community that validates your feelings, so you don't feel alone. When you're sitting there saying, why am I the only one that's going to work every day and thinking this isn't for me, or that I couldn't do this every day, or I should. There's this whole sunk cost fallacy where we think we've spent so much effort, time, money, resources in studying this, and we should therefore embrace it and love it and enjoy every single moment that we do it and follow that path that everyone else has trodden for us. And it's like, it's okay to feel like maybe this isn't what you wanted to do all day, every day, or you have some other idea that you want to work on. we work for a long time. If you think about, life expectancy nowadays and retirement
Retirement age,
ages,
yeah, sure.
I don't expect someone to do the same thing all day, every day for the rest of their life. I think
Mm,
that would be very boring for them. So it's okay. And I think that community gives you that validation. I think the next step is to try and figure out, what do you enjoy? Like, what is the stuff that gives you real pleasure? What's fun for you? And Joe, that was, you realizing that you love working with people and helping them, with their coaching, with the coaching aspect, or,
mm,
like doing this podcast and exploring things with guest speakers. And,
yes.
you find your loves and your passions, and then you think, who can I talk to, or who can I connect with who's already there, who might be able to
Mm,
help me, who can give me some tips and some pointers. And I just challenge everybody to, to change things up. So if every year you go to, a cardiology conference and you think, that's my tribe, but you really want to try some other things, maybe mix it up and go to a different type of conference. Maybe
mm,
you go to, a digital health or an innovation conference, or you go to a biotech conference, or you go to a pharmacy conference. You just try something different,
sure.
mix with different people, and start to get a perspective outside of, maybe the narrow specialty that you work in.
Mm,
And and I often find it's in those environments that you meet really interesting people. People don't like the word networking, but I say, it's just, opportunity comes from being in the right place at the right time. And if you're in
mm,
lots of different places, you get lots of different opportunities.
yes.
So the more places you position yourself in, the more likely something's going to come up that just has your name written all over it.
Yeah.
You bump into someone, and then the next week they're thinking about an advisory board for something that they're doing, and they're like, oh, I just met this person at this conference last week, they would be perfect.
Mm,
And before you know it, something happens. And so I just encourage people to get out there, network, meet people, go to events. It was very hard during COVID, but now post-COVID, we can do that. Get onto some of the online forums or groups of the areas that you're interested in.
mm,
And, the most important thing is just, use your networks and leverage people, because people are actually very generous with their
yeah.
time. And if you ask them about how they got where they were, where they are, or how might you step out into that area, most people will be happy to talk to you about their experiences. And so, the worst thing is that they're going to say no. So just reach out, ask
Sure.
for help. But I think that's the first steps, to really start broadening your horizons.
Yeah, no, great tips, great ideas there. I'd also add to that list of consider maybe a retreat. I think there are more and
Yes.
more doctors that are running retreats, like Dr. Emily Amos, who I've
Yeah.
interviewed way earlier on this podcast. She runs beautiful retreats for doctors all around Australia, and you can be guaranteed to meet doctors from all walks of life
Absolutely. Yeah.
with her very grounding and centering kind of approach of, well, why am I here? And what do I really want with this one
Yes.
special, precious life we have?
Yeah.
And I
I
think
think,
another
yeah.
point I'd love you to talk around would be how quitting isn't necessarily the answer. And I hear that coming out from the NHS or the UK version of the Clinical Entrepreneur program. And it's
Mm-hmm.
also something that encourage my clients to consider when coaching, that even if you're in burnout, quitting is not necessarily the answer, because you'll maybe bring your same mindset to a different job and go hammer and
Yeah.
tongs, type A personality, overachieving, and then you'll burn out in a different environment.
Yeah.
Do you have any thoughts on that concept, please, Amandeep?
Yeah, look, I mean, I think part of the evolution of CCIM has been that when we first launched, I remember speaking to some people in the medical field who were like, "Oh, you're just encouraging a whole bunch of doctors to quit medicine, and
Mm,
that's not what we need, right? We need workforce." Um, and I was actually, in complete disagreement about that, because I said, I'm not actually sitting here encouraging people to leave. Well, what I'm encouraging people is to reframe, who they are and how they use what they have.
mhm,
And it may be that you cut back. It may be that, if it's the environment that you're in, you try a different environment. It may be that you gain a new skill, or you look at, trying to pursue something that's just slightly adjacent. It may be that, you take a break and then you come back. I said it's not about quitting completely, because I actually think that's, almost what we're trying to stop happening. Because when I first started talking to people, people say, okay, I'm just leaving medicine and I'm going to go open up a florist. And I'd be like, what do you know about flowers? And I'm like, well, how about, what is it that you don't like about medicine, or what is it that's troubling you, or why are you burnt out? And when you get to the core of it, you find out that it's the particular specialty they're in, or that particular hospital, or it's that they just don't like seeing patients, or that they get anxiety every time they walk into a room because they don't know what it's going to be about. And there's a whole bunch of things when you unpack it, and you're like, well, let's address those, rather than the knee-jerk reaction of walking away from 10 years of a career in something that you've built a lot of expertise and skills around.
Yes.
And I have now watched, surgeons end up at management consulting firms using all their healthcare expertise to solve problems on a system level. I've seen GPs end up, in digital health companies working as clinical advisors. I've seen, specialists end up in, the pharmacology space, working with big pharma. And, I've seen a lot of the movement of people around the space, and it's not about quitting. It's about readjusting, where you're meant to be and where you get joy and pleasure from. And sometimes it is, as you said, Joe, like taking a break, whether it's a retreat, whether it's a few months off, whether it's, doing a sabbatical, or going and doing a locum somewhere else, and just getting a different perspective, getting away from your every day to day, and saying, how can I look at this all differently, and how can I do the work on myself to figure out what is it that's not working for me? And there's lots of solutions. It doesn't have to be just quitting. It's never just binary.
Yes.
I'm here or I'm not here. It's like, no, there's lots of shades of grey in the middle where we can work through and, actually help people continue to offer their tremendous skills back into the sector.
Yeah. Yeah, so great to offer that and suggest that to people who in burnout can be quite black and white in their thinking as well. So let's just peel away some of the layers and just see if there are the shades of grey underneath there. Okay, the final question I'd love to ask you, please, Amandeep, I ask all of my guests, is if you're happy to share a part of your self-care routine that you really love or you rarely miss.
Part of my self-care is having to be in nature. So it's really important. And I know when I get to that point, obviously try and do it on a weekly basis. But, when you live in the city, in the middle of the city, it can be hard just to escape and get away. But for me, it's like finding that space and just being, with, alone often, and being with, the ground, and being around nature and greenery, and just feeling like refreshed about like this beautiful earth that we're part of. We're so lucky to be here, so lucky to be alive, and also reminding yourself how small you are, like the particular trips to the ocean, and I live really near to the beach, which is great for me, and just looking at the mighty power of the ocean and reminding yourself that you're just this tiny little thing, and that nature is so much bigger than us, and we've got to go about our lives just remembering the perspective that your problems may seem big, but actually we're all just little things floating around on this earth, and it's never that big. So I like that. It grounds me, and I can always tell that I'm heading for burnout if I haven't been in nature and haven't stocked up on all of my exposure out into the beautiful world that we live in. So that's really something I can't do without.
Sure. Love it. Great. Thanks for sharing that. Well, Amandeep, it's been an absolute pleasure having you here on the podcast today. We'll be adding links to the show notes of where people can find you, and also links to Creative Careers in Medicine if people are curious about finding that there. Is there anything else you'd like to add to the listeners today, please?
No, they just absolutely love the work that you do, Joe. And I think, you're just such a, beautiful soul trying to help so many people. I've thoroughly enjoyed you being on the clinical entrepreneurship program as well, as I've got to hang out with you. And I love how much you're trying to help your peers, and, really applaud that you've stepped out, been brave and built something amazing.
Amandeep, thank you so much. That's really kind words. It's great to work with you and the whole team with the clinical entrepreneurs. Thanks again for being on the podcast today. See you then.
Thanks so much.